All right, let's talk about diet and hypertension. We're going to build a really practical, evidence-based guide that you, as a busy clinician or trainee, can actually use. Think of this as the clinical framework you can put into action with your very next patient.
We've all been there, right? You tell a patient, hey, you should cut back on salt. But what's next? What's the really high-yield advice that the evidence actually supports? Let's dive in, because the real answer is so much more comprehensive and honestly, way more effective.
Okay, first things first, let's get one foundational principle straight. Lifestyle changes, non-pharmacologic therapy, this isn't some optional add-on. For pretty much every single patient with hypertension, this is a core indicated therapy. It's the bedrock of good management, not an afterthought. So here's our game plan. We'll start with why lifestyle is always the first line of defense. Then we're going to do a deep dive into the DASH diet itself. After that, we'll decode the landmark trials that put it on the map, touch on some other dietary factors, and then wrap it all up with some real-world tips for prevention and patient counseling. Right, so here's the crucial point. For patients with what we call elevated blood pressure or even stage 1 hypertension, these lifestyle changes might be all they need. I mean, guidelines actually support giving it a shot, lifestyle modification alone, for 3 to 6 months before you even think about starting a medication. That's our window. That's where we can make a huge impact with diet. So let's talk about the single most powerful tool we have in this non-drug toolkit, the DASH diet. That stands for Dietary Approaches to Stop Hypertension. And look, this isn't just about cutting out one thing, it's a whole new dietary pattern, and the evidence behind it is just incredibly solid. And this quote just says it all. I want you to really let this sink in. Sticking to the DASH diet can lower a person's blood pressure just as much as taking a single blood pressure pill. That is a total game changer, especially when you're talking to patients who are maybe a little hesitant to start on medication. So what does it actually mean to be on the DASH diet? Well, it's a diet that's absolutely packed with fruits, vegetables, legumes, and low-fat dairy. And we're not talking small amounts here. We mean 4 to 5 servings of fruits and another 4 to 5 servings of vegetables every single day. At the same time, it's specifically low in things like snacks, sweets, red meat, and, importantly, total and saturated fat. It's a fundamental shift in how a person eats. Now let's talk about the evidence, because these recommendations didn't just come out of nowhere. They are built on a series of really well-designed, super influential clinical trials. Let's break down the big ones. So check this out. From the original DASH trial, they tested a few different diets. And what's so cool here is the comparison. A diet that was just high in fruits and veggies did lower systolic blood pressure by about 2.8 millimeters of mercury. But the full DASH diet, the one that also added low-fat dairy and cut the saturated fat, it nearly doubled that effect, bringing systolic BP down by 5.5 points. It really shows that the whole pattern is what matters most. But here's the kicker. When they zoomed in on just the people in the study who already had hypertension, the effect was massive. We're talking a mean drop in systolic blood pressure of 11.4 points. I mean, come on, that is a profoundly huge reduction from diet alone. So, the next logical question was pretty obvious, right? Okay, the DASH diet is amazing on its own, but what happens if we combine it with that classic advice we always give, cutting back on salt? And that question led to the next landmark study, the DASH sodium trial. For this study, they got really clever. They tested both the DASH diet and a typical American diet at 3 different levels of sodium every day. A high level, an intermediate one that's kind of close to the daily recommendation, and then a really low level. And the results were just, wow. If you took someone with hypertension and moved them from a typical high-salt diet all the way to a low-salt DASH diet, their systolic blood pressure dropped by an average of 11.5 points. This just perfectly shows the incredible synergy you get when you combine the DASH pattern with sodium restriction. And finally, there was the premier trial, which gave us a necessary dose of reality. See, in those earlier studies, the researchers actually provided all the food. Here, people had to prepare their own meals. The results were still good, still significant, but not quite as dramatic. And that highlights the single biggest challenge we face: getting patients to stick with it in the real world. Okay, so you know patients are going to ask you about specific things. Doc, should I be taking a magnesium supplement? What about fish oil? So let's do a quick and dirty run-through of the evidence for these individual nutrients. Here's the high-yield summary for you. High fiber, yeah, it gives a modest benefit, a little more so in older folks. Swapping some carbs for protein might help. Magnesium intake is linked to lower BP, but the data just isn't strong enough to recommend supplements for it. Calcium's effect is pretty uncertain. And fish oil, you need really high doses to see even a modest effect. The big takeaway here is that none of these individual things even come close to the power of a comprehensive pattern like the DASH diet. So, how do we take this mountain of data and actually use it in the clinic? How do we apply it to prevent hypertension in the first place? Let's translate all this into some actionable advice. I love this data from the Nurses' Health Study because it's such a powerful visual for prevention. Look, just sticking to a DASH-style diet was linked to an 18% lower risk of developing hypertension. That's pretty good. But now look at this. Women who followed all 6 healthy lifestyle factors, we're talking diet, exercise, healthy weight, the whole shebang, had a staggering 78% lower risk. It just shows that while diet is a key piece of the puzzle, it's part of a much bigger and way more powerful preventative picture.
So here it is, your 4-step clinical toolkit. Number 1, always prioritize counseling on a whole dietary pattern, like DASH, not just single nutrients. 2, make sure to layer on that sodium restriction to get the biggest bang for your buck. 3, please don't try to do it all yourself. A referral to a nutritionist or dietitian can make a world of difference. And 4, give your patients good, reliable resources to take home.
And speaking of resources, you don't have to reinvent the wheel. Excellent, patient-friendly materials are right at your fingertips. UpToDate, for instance, has the basics and beyond the basics handouts you can literally print out or email to your patients right there in the exam room. So, we'll end with this question. The evidence is rock solid. The effects are impressive. The real challenge, the one we all face in clinic day in and day out, is this. How do we help our patients bridge the gap between knowing this stuff and actually doing it in their daily lives? Overcoming those real-world barriers of cost, time, and habit? Well, that's the next frontier in truly using diet to fight hypertension.